What is intraocular lens? IOL options. Blurred vision due to cataract can affect your daily life and you may need cataract surgery. Cataract surgery is a commonly performed surgical procedure. Eye surgeon removes your cloudy lens which has become blurred due to cataract and replaces it with an artificial intraocular lens, also called IOL. Choosing the right IOL for your vision needs is important while planning for cataract surgery. There are various IOLs like monofocal IOL, next generation monofocal plus IOL, and continuous range of vision IOL. Monofocal IOLs, which help you with sharp vision to see far, so you only need your glasses to focus on objects at intermediate and near vision. Monofocal plus IOL. These are next generation monofocal plus lenses designed for high quality distance and enhanced intermediate vision to make everyday tasks easier. The continuous range of vision IOL not only addresses presbyopia as part of cataract surgery, but also allows you to see a continuous range of high quality vision, which may reduce your dependence on glasses. So, if you are undergoing cataract surgery, choose your IOL as per your visual requirements. Issued in public interest by Johnson & Johnson.